I am live tonight, folks. How y'all doing? All right, tonight we're going to talk about ankle and foot. Now, in my little comments part to this, I did talk about, we're going to talk about plantar fasciitis. We're going to talk about bunions. We're going to talk about ankle sprains. We're going to talk about Achilles tendon a little bit, tarsal tunnel. We're going to talk about all these different things. I'm going to go ahead and just get myself logged in here a second. Beautiful. No one's here yet. That's awesome. All right, so hopefully people will start to show up. Go testing, you can hear me? Go testing, you can hear me? Good. Oops, just turn it off. All right, so I'm gonna give everybody a few minutes to show up. Go ahead and minimize that. Hey, Lionel. I'm coming in good. All right, thank you, sir. I got two. Hopefully, I'm going to have some more. I have some creators and non-creators coming to this, so they should hopefully start to pile in a little bit. So tonight we're going to talk about, like I said earlier, about 4 or 5 different things that can happen basically to the ankle or foot that I normally see in physical therapy over the last 20-some years and that we actually work on. So I'm going to go over the common ones tonight: plantar fasciitis, tarsal tunnel syndrome, bunions, ankle sprains. I'm going to go over Achilles tendon, heel spurs. We're going to go over what kind of issues you might have after having an ankle surgery. So we're going to go ahead and get started here in just a second. Hey, David. Oh, don't worry about it either. I wear glasses, so my eyesight's not that great either. All right, so you know what? We're going to start to do a little one-on-one. If you guys have any questions on anything, go ahead and just shout them out in regards to the ankle or foot. Or, if we don't get anybody, maybe this will be just a simple 1-on-2. But I doubt that will happen. I'm sure we'll get some more in a little bit. But let's start out with what I see a lot when I see someone come in. Normally they come in, they have some ankle or foot pain. They might have some numbness or tingling in the foot and ankle, and sometimes the physician might send them and say that it's maybe sciatica symptoms coming from their back. Well, after I've screened the back out in the hip and realizing, all right, it's just in the foot and they don't have diabetes or something like that, I try and figure out what's going on in the foot. And so there's this one main nerve that goes, so if we look at the foot straight on and we kind of turn you inwards, so this bone right here is your shin bone or your tibia, and the outside bone is your fibula. So that nerve that I'm talking about runs all the way down. It goes underneath your ankle and then goes across the foot on the bottom. And so I'm going to show my stinky little foot here for a second. So that bone, what I'm talking about, if you look at it this way, that nerve runs all the way down on the inside and makes up your foot. And that can give you some numbness and tingling, and that's called tarsal tunnel syndrome. Now, in our entire body, our arteries, our nerves, and our veins run as one unit. Think of it as an electrical cord, and you have the red, positive, black is the ground, and you have the maybe one more wire in there. Just think of those bundles, and that's how our entire body is set up. Our artery, nerve, and veins are run together throughout our entire body. And so you could even have some cold sensations sometimes with it too, and that could be a vascular problem. But we're just talking about the numbness and tingling. You can get it in your ankle. It's the same concept as it is in your wrist with the carpal tunnel, where you can get some compression from the ligaments being too thick or the tendons being irritated, as well as you can in the foot. And so if you have some numbness or tingling just on the inside of the foot where it's really tender, that can be tarsal tunnel syndrome. I see it a lot when people have flat feet. So the foot is basically flat down, and it's putting a lot of stress on that nerve. The best thing you can do probably is either A, see a podiatrist or foot doctor about orthotics. You could try and just go to Walmart or whatever and pick up a cheap one. But the reality is you'll want to, that orthotic that you get needs to lift up your arch. And what that does is actually shortens that nerve and actually reduce some of that stress and tingling in the bottom and in the inside part of your foot. That happens a lot with people with flat feet. It happens a lot with people who have plantar fasciitis, which is the next thing we're going to go into. So people might call it plantar fasciitis. I just call it plantar fasciitis. What happens is if you are a tendency to use like flip-flops, or if you're a woman who wears heels a lot, our body uses our toes to curl down so we kind of don't fall. You do it enough, that'll start to irritate that tissue in there. Now the plantar fascia basically is this thick fascious tissue that separates all the muscles in their little compartments. And so they help kind of keep things organized. And when that tissue gets inflamed, it also starts to inflame the muscles around the area too. That can happen a lot of prolonged walking, standing on concrete a lot, or something that's a hard surface where there's no give and your foot has to do all the giving. The surface doesn't give anything. If that happens long enough, over time, it goes away and comes back. You take some ibuprofen or some other anti-inflammatory. They give you a shot in your foot. Usually it's a steroid like prednisone or dexamethasone. Then that will stop the inflammation. Here comes the problem. Our body over time, when it gets traumatized, wherever it is, whether it's our spine, shoulders, elbows, or in this case in our foot. My wife has back issues. Are there special shoes she can wear that won't hurt her feet? The best thing you can do, so if we looked at the basics, so I'll stop for plantar fascia just to answer Dave's question, since he was so nice to come. And also Lionel. If your wife has anything that if your feet are supposed to be level naturally, and if her feet cave in at all, like flat foot, or just the arch starts to drop, then yes, she's going to want something that kind of brings her arches back up to level, and that will hopefully help reduce the pain. What you should notice by the naked eye is also her knees will start to collapse inwards on one another as your feet are caving down in. Your knees will also follow that, and then your back, and so on and so forth. And also when you stand and sit, if your feet collapse down in and your hips aren't strong enough to compensate, your knees will start to go together. And that's also telling me that, yeah, you can have a lot of problems. So the shoes, there's nothing specific. You really just, it would depend on if she has a high arch, you want a low arch. But my guess is if she has flat feet, you're going to want a type of shoe that gives a higher arch so that her feet can stay level. And hopefully that will help reduce her pain in her back. And a lot of times it's not the walking or standing that's causing a lot of the pain in the lower back. It's usually something, whether it's prolonged sitting incorrectly or something like that. And when you go to stand and walk, yeah, it's already aggravated from whatever you've done for the last few days. And then when you stand and walk, it just kind of adds more gas to the fire, so to speak. So that's the walking and standing usually is not the origin of why you're having pain in their back usually. It's usually a secondary problem from that. Hopefully that answers your question a little bit, Dave. But, I'm not, the best thing I would say to you also, if you think that the feet are flat, the best thing you can also do is look at the bottom of her shoe, the shoes that she wears a lot. If they're worn on the inside of the heel, all right, she's collapsing down in. If she's worn on the outside of her heel, obviously she's walking on the outside of her. Every time she takes a step, she's landing on the outside of her foot. You don't want that. The normal wear is basically in the middle, through the center or the inside towards your big toe, and then towards the middle part of your big toe. That's normal wear. Anything else, you're having an alignment issue, and it might be able to help. It might. There's no guarantee, but it definitely doesn't help if your shoe is wearing wrong. And if that's the case, if your shoe is worn already, you're just reinforcing the bad pattern because you're literally in a molded position now because you've worn that part of the shoe like a wedge. So it's wedged. So you better off getting rid of those and getting a new pair of shoes so you're starting with a nice, flat, even surface. Thanks, Foxfire. I appreciate you coming. We got two good guys here that are really good. They will watch and look at your stuff. They watch my stuff. I watch their stuff. So it's good to at least connect with these two brothers. That's right, Lionel. If the foundation's off, the rest of it's off. I mean, the classic case is a leg length discrepancy. If one leg is longer or shorter than the other, and it's about an inch. If your leg length is an inch or greater, then you need to do something about it. If it's anything less than an inch, I was always taught in school that you're basically wasting your time, that's not probably where your pain's coming from. Try not to use no more than 1 or 2 emojis because I'm going to have to delete that because they're going to consider that spam. Thank you, sir. All right, I made Dave and Lionel my first two. You guys are two. You're moderators now. So you got to say, 6 months down the road, hopefully when I got a lot more people, you can say, yeah, we were the first two moderators. We were here at the start with Joe, and we're still here. We're learning a ton, and I'm hoping you guys have also reduced your pain too, or at least given you some information. You figure if you didn't look at my bio, I have a clinical doctorate degree in physical therapy. I've been in physical therapy since 1999, and then I graduated my doctorate degree back in 2007 and 8, something like that. I graduated with my master's degree in 2006, and so I've been doing this a long time with a lot of education as well as weekend courses that I've gone to over the years. So I gotta I don't want to toot my own horn, but I can physical therapy wise I can usually help a lot of people. All right, thank you, Firefox, for coming by. Wear that blue wrench with pride. Lionel, you're awesome. All right, so I'm going to go back to the misconception of heel spurs in general. And so we're going to talk about plantar fasciitis, but this could be anywhere in the body, whether it's your spine, and your spine is called osteophytes, okay? Bone spur, calcium deposit, osteophyte are all the same meaning. They're just described in different parts of our body. They mean the same thing. And what happens is our body can only do a few things. That can build up to try and protect itself through excessive stress over time. In this case, I'm talking about a heel spur. People think the heel spur causes a plantar fasciitis. That's not the case. It's just the opposite. It's the constant stress of those tissue. Symptoms go away. They come back a few months. They go away. They come back a few months. The doctor does an x-ray. He's like, holy cow, you got a heel spur. All right. That's actually from the tissue causing this inflammatory process to come and go in that certain spot. Your body builds up a calcium deposit, and in this case, in the foot or heel, we call it a heel spur. So that could be in your shoulder, that could be in your neck or anywhere else, but that's exactly what happens. And then you're talking about the rope on the metal. It's just fraying that tissue and just chewing into it at that point. Oh, absolutely. I'm going to throw it here just for a second. Let me show you my shoulder. Some people with shoulder problems. So I'm just going to throw this to the side here just to kind of give you an idea, Dave, since it's just It's just a few of us in here. Hey, you might as well chew my brain off a little bit. But in the shoulder blade, you have this thing on the end. It's called your AC joint. The A meaning this bone right here called the acromion, and the C is your clavicle or collarbone. Those two meet called your AC joint. Now this end of the acromion here, as we age, you can actually start to build a hook on the end of it. They have 3 grades to that. 1 is normal, 2 is a little bit thicker, and 3, there's a huge hook over the acromion, and you can only really tell it on an x-ray. And what will happen is as you raise your arm up, that hook will start to tear into your rotator cuff and give you instant pain. So you can get all kinds of weird stuff in regards to body's ability to only take stress for so long before it starts to react in other ways. You can actually get, if you traumatize a muscle group hard enough, you can actually get bone growth within a muscle itself if it gets traumatized. And then you're dealing with surgery. You need to have immediate surgery. And so your body can do some wacky things. And I think probably maybe in a few weeks, I'm going to do some more research on it. But I'm going to go over some abnormalities that the human body has. You know, we're not cookie cut. Certain people have certain tendons in the hand or certain extra ligaments other places. And they have an extra disc in their tailbone area that other people don't have. And so there's all these weird abnormalities people can have. And it isn't until, you know, they call them birth defects or whatever, but they're really just abnormalities. And until you have a medical problem or until you have an MRI regarding something else, they're never shown. Yeah, you can have I mean, people who've had strokes or traumatic brain injuries, when the one side becomes what we call flaccid or doesn't work no more, that joint right there, that AC joint that you have a permanent separation from, starts to pull down because the arm gets so heavy, and because there's no muscle tone to hold it in place anymore, you start to get that stress, that joint, as well as the rotator cuff. And so, yeah, you can get a lot of pain with that. All right, so we went over plantar fasciitis. We went over what can cause what the heck's a heel spur and how is this caused. Let's go ahead and talk about for a second ankle surgeries. And so a lot of people that come to me, and let's say they had to fuse some of the ankle bones. And so a lot of times they usually, if there's a fracture within or below the at the ankle where the tibia kind of meets. So if we look at your foot, your fibula bone comes all the way down at the bottom, and that's the outside of your bone is that fibula bone at the end, or what we call a styloid or malleolus. And then on the inside is the other bone. That's the tibia. That's part of the tibia that comes down and makes the inside of your bone. Those two bones together kind of start the ankle joint that moves back and forth. And when the surgeon has to go in and put some bolts or screws and starts to have to fuse some of the joint, we're starting to have some issues at that point. All right, Lionel, thanks. I'll see you in a few minutes. All right, and so when your ankle, if you've had surgery at all, the biggest thing that we need to worry about is making sure that this tibia or shin bone comes over your foot. So it comes forwards like that. If your shin bone can't come over your foot, you're going to limp. It's going to feel like you take a step and you can't go. And you start to, as you can see, my shoulder moves, my back and hip moves to try and compensate for the lack of movement at the ankle. And so a lot of times, if they fused it at some point with bolts or screws, we have to go ahead and try and get this Achilles tendon that runs down the back side of your leg. All right. It starts to meet down here at coming towards the base of the ankle, and it attaches to the back of this heel bone called the calcaneus. Now, the two big muscles that attach to that are called your gastrocnemius and your soleus muscle. Those two muscles kind of come down and attach and make that tendon. Now, the one muscle that crosses the knee joint is your calf muscle, as we call it short, but the gastrocnemius, the soleus, does not cross the knee joint. But let me get a sip here a second. So we have to work on stretching that Achilles tendon out as much as humanly possible so that ankle can start to come forwards more to try and compensate for the lack of movement in this, what we call the mortise. Okay, there's a subtalar joint. Okay, there's a crural joint. So there's a couple different joints that someone's made a long time ago, and sometimes they have to fuse that if it's unstable, or if it's been fractured, or it's been, it's been broken apart for some sort of trauma. So that's the big issue with the ankle when it comes to if they have to fuse it at all. Now, so when we talk about that Achilles issue coming down, you can get an Achilles tendon. Now, it's classic that any long tendon in our body, whether it's our bicep or whether it's the long tendons of your forearm, or in this case, your long tendon of that Achilles tendon, the longer tendons are classically able to get inflamed and traumatized just because there's more instability. There's more mobility, more movement, but there's more instability because of that. They weigh the options out. You can't have both at the same time. You get one or the other. So in the ankle, you need to have a lot more mobility, and so that Achilles tendon is a lot more unstable. So it can get inflamed when you have this type of problem. Now, there's 3 phases to a tendon anywhere in the body, whether it's the shoulder or anywhere. Okay, there's peritendinitis, happens within a few days and goes away. There's the tendinitis that everybody overuses. And then after the inflammatory has stopped, but the tendon actually did not heal, it's called tendinosis. Most of my patients that see me, okay, they've been to the doctor. They probably had the injury weeks or months before that and drugged their legs, hoping that it would just heal on its own. So by the time they see me, it's a good old ripe tendinosis. That means the inflammatory process stopped and the darn thing never healed. Hi, Harry. Do you have any questions at all? Go ahead. I don't know why I'm shouting at you. I got to get used to this live camera stuff. You can go ahead and if you want any questions at all regarding the ankle, the foot, or anything like that, I'll even give you, if you have some questions about anything else, since it's such a small group, I can go ahead and answer some of that stuff too for you, Harry. All right, so we got done talking about, so we got the Achilles tendon, and what do we do whether it's a shoulder or whatever, and it's been 3 or 4 weeks, all right, and it still hurts. That tendinosis has to be restarted into a tendinitis. So technically, for the body to heal itself, it has to naturally go through the phases of a tendinitis. That's how our body heals itself, is through the inflammatory process. And so we got to be able to go through the process correctly, all right, and then strengthen you after it's healed itself enough, because once it's healed a little bit, it's very weak, and at that point can get very inflamed again, and then you start the whole cycle over again. So we do have to try and get that thing inflamed. There's different techniques we can do. Usually it's hands-on, usually either cross-friction massage or strumming or DP ultrasound to get that blood flow in there and try and get that thing to react and get some more blood in that and try and get that tendinosis to turn back into tendinitis. And then we can do some taping techniques and stuff like that to help reduce the pain, maybe give you a heel lift or something along those lines, to help get you through the painful process again of the tendinitis so that it can actually heal itself. So that's the basics of an Achilles tendon. Now you can rupture the Achilles tendon too. I've had a few of those, but obviously patients got to have surgery. If they completely rupture the thing off the Achilles tendon, it's going to have to be surgically put back on. Now, I've never heard one, but in the books it says it sounds like a shotgun goes off when the Achilles tendon ruptures. Had one, they said it was very painful. I can imagine it would be. I actually saw a long time ago someone that actually ruptured both their patellar tendons ruptured. They slid down the hill and they blew both their patellar tendons at the same time. That reminds me, probably this next week or the week after, I'm probably going to get a knee model. I'm almost all modeled up, but I do have to get a knee model at some point. That means I'll have to work a few extra hours to pay for one. Anyways, so you're asking, so plantar fasciitis or a good old-fashioned Coca-Cola bottle used to, yes. So if we're talking about the treatments for plantar fasciitis, all right, I'm going to give you the real skinny down. Yes, you can do the basic ice bottle roll where you take a screw top bottle, you fill it half up with water, you put it in the freezer, and you have an ice bottle roll. The reality is this: when you first get up in the morning, you need to stretch that plantar fascia. You need to get to one heel and then take and kind of stretch it out. Hold that for 30 seconds to a minute, and then kind of gently rub it back and forth. It's going to hurt. It's going to be sore. But the reality is you want to get blood flow in there so you don't cause another stretch tear. All right, because that's what happens. It's been short through part of the night. That plantar fascia was in a nice shortened position, all right, with the toes kind of relaxed. The tissue started to heal, but then you got up and you stepped and you put all your weight and you caused an instant stretch of it, and it causes that tissue to re-tear, and you cause that process all over again. So it's very important that you initially start by stretching and kneading that in the morning, all right? And you have to work through that. I also tell people take a golf ball. I have this in one of my plantar fascia videos or tarsal tunnel that I did when I first started out. Video-wise, it's not very good, editing-wise and lighting, but it does give the gist of all the different treatment techniques that you can do. The golf ball roll, I tell people to heat up their foot for maybe soak it for 5 or 10 minutes or put a hot water bottle or whatever. Golf ball roll for 5 or 10 minutes and sitting, then ice bottle roll, all right? That's a good technique. You can get that Leuco tape that I keep blabbering about. That's in one of that, also in the plantar fascia or tarsal tunnel video. I show you how to tape your foot to keep that foot in a nice shortened position for a couple days so that tissue doesn't always go on stretch and cause that same pain again. Yeah, I mean, you're definitely going to want to do some of the stuff. And the best thing you can also do since you're on concrete all day is just a really thick cushion. Now, you could do a sponge, but you need something that's thick enough, but also the height of the back part of your shoe needs to be high enough, so at least a 3/4 or a high top shoe, so that when you put that cushion in, your foot isn't completely out of the shoe. So that's what I do with some people, is I used to give them, when I could, I'd give a really dense foam. You could probably go on YouTube and just type in dense foam, cut a piece of it out, and put it in the back heel. And so every time you take a step, it's a nice cushion. That'll last for a week. Take it out, cut a new piece in. Because when you go to the stores, those gel cushion things, they last for probably about a week, and then that's it. They just can't take the beating. They're not designed to take the beating. But that thick foam cushion will. Just Amazon it, all right? Dense foam, all right? It comes in sheets. It can come in a million different colors. You just cut that off, and then you can use that. You can do the whole strip of your foot, or you can just do the heel part where the plantar fascia issue really starts at, because that's the issue. It starts in the heel, and then the pain refers up into the toes and the rest of the foot. And as you heal, your symptoms go away from the toes and just go back to the origin, which is back in the heel. Well, that's good. You wear steel toes. That means you have a high top shoe. Yes. I implore you, that stuff does work. Dense foam. That will work. I've used it before in the past. When I worked at Frito-Lay many moons ago when I was in school, I know all about being on concrete, putting bags in a box and putting them on a pallet for 8 to 12 hours straight. All right, so let's go back. So plantar fascia, if you got any more questions on that area, just give me a shout out. We went over tarsal tunnel. If you have any questions about that, heel spurs and where they come from, ankle surgeries and what we worry about as therapists, Achilles tendon problems and what we worry about with that. Let's go ahead and we're going to talk about ankle sprains. So the basic ankle sprain everybody talks about is an inversion sprain. Basically, you take a step, the outside of your ankle rolls down in, and you basically sprain the outside of the ankle. I think I did a video probably, I don't know, 3 weeks ago or something like that. It's one of my newer videos, so hopefully it's pretty decent. But it goes over the what we call the ATF, or the anterior talofibular ligament, and that's basically sprained 70-80% of the time. It's something like that. And so that is the anterior. So these are just basic terms, which means the front. All right, that means that there's a ligament on the back side, the posterior or the back. All right, so the talofibular ligament. So we have the talus bone that's underneath this tibia bone, and you have your fibula. So that's basically this ligament here, which makes sense because when you roll it, you're going to stretch that whole part of the foot. And that's the main one that you sprain right off the bat. Now, you also sprain the calcaneofibular ligament. That runs from the heel, which is the fancy word for heel is calcaneus, runs to the fibula. And so that's another one. That's the other like 10 or 20% or whatever. Those two usually get sprained at the same time. Your ankle blows up. And next thing you know, you don't have a bone on the outside of your ankle. You just got a big ball of fluid. So when we look at that particular problem, you always start with something called RICE. Rest, ice, compression, and elevation, and wrap the darn thing to try and give you some stability. Now, word to the wise, when you use an ACE wrap, I learned this, I don't know, moons ago now, but the ACE wrap themselves, now I showed this underneath the one video I did, I think was on lymphedema and managing managing back pain, or excuse me, not back pain, managing swelling in the legs and stuff like that. It was a fairly long video. Not a lot of people liked it, but it had good content. I talked to my very good occupational therapist. I won't put her name out there, but she's a lymphedema specialist. She's a wonderful woman. Her and her husband are great. And so there's a couple different types. Now, if you do a regular ACE wrap, I know this, that the ACE wrap stretch is only good for one time. Now, you can continue to try and stretch it out and tighten it even more, but you're going to end up cutting off your circulation or cause some sort of skin breakdown. So the ACE wrap that you see in the supermarkets, or I should say supermarkets, at like, Walmart, CVS, Walgreens, anything like that, they're only really good for one pull. They stretch pull once and that's it. You don't regain that tensile strength. Now, she has this nice little wraps that you can get online. This she uses for lymphedema. This is Comprella. You can get this. This is from good old Germany. Those good old Germans. I got an Audi. These Germans, they know how to make cars. And what's this? Von Braun. If it wasn't for Von Braun, we wouldn't have NASA because he had the V2 rocket. So even though he wasn't such a good guy, we probably wouldn't be having rockets like we do today. But anyways, so this wrap's made in Germany, and it has as you can see, it's very good because it retains its tensile strength, so you can wash this and reuse this. So if you're having ankle problems, or maybe an elbow problem, or a knee problem, and you want to use an ACE wrap, you're better off getting something like this that looks like an ACE wrap, but it's really not. And it holds up very well. You can wash it. It's obviously air dry. You don't put it in a dryer, it'll melt the darn thing. But you could get something like this. This is pretty decent. I think these run like, these aren't cheap. I think they were like $7 or $8 for a thick roll of this. All right. Oh, okay, Dave. Your son got a sprained ankle. So this is classic for him. And if it doesn't still feel good, if he still has a lot of swelling on the outside bone, you can't see that bone very well, what we call the lateral malleolus, all right, which is the end part of the fibula bone, which is what I talked about. He probably needs to go and see someone, because the reality is he might have tore one of the ligaments back there, or he might have tore one of the tendons. There's a weird tendon that comes down through here, all right, and it's easy to tear any of that. Those muscles along the side of your fibula come down. They're called the peroneal or perineal, depending on where you're from. And there's 3 of those muscles. And he could have easily torn one of those tendons in there. And so if it's staying swollen like it is, then that's your body telling you, hey, something's still going on. All right, Mesh. Thank you so much. I'm giving you a shout out too. I promise you, excuse me, when my live stream is done, anybody who gave me a shout out, I'll be going to theirs and I will be giving them to subscribe to them. And I am a very loyal subscriber. I watch the videos. I watch the commercials. I'm not one of these bozos that comes on for 5 seconds and then leaves and ruins their watch time. It happens a lot. I'm like, I make the really good video. I spend hours on my videos. I spend probably to make one of my videos, to color it, the audio, the lighting, the special effects I do, and coming up with the draft of the whole thing. It takes me somewhere between 7 and 8 hours to finally get that thing completely done, and the music and all that right now. So, hey, I'm all about, looking at other people's content, but people just don't realize when people put a lot of time in and you're seeing their video for 30 seconds and they have a 5 or 7 minute video, you're not helping them, you're killing them. What happens is YouTube essentially says that, hey, no one likes your content, or they're not staying long enough to watch your content. They're going to push your video right off the charts within a couple of days if that is like that. So they're not helping anybody. If anything, you're really hurting the creator. I have to remove anything that has more than 2 emojis to it because YouTube, when they come back and look at this video, they might consider that spam. So that's why I had to delete that 3 hearts. He has sporadic pain. Yes, that can be natural if you're on it a lot. Let's say initially he walked when he first heard it, and let's say it was 4 weeks and he started walking on it more. The more he walks on it throughout the day, all right, the more he can get pain with it. And there's this little, I can't remember the actual term, but there's this little box down inside your ankle on this side, and fluid loves to pool in there along this inside this calcaneus between the fibula and that heel bone. And so that's classic. You could expect, if he sprained it pretty well, you could expect at least probably between 4 to 6 months. If he has to be on it a lot, still would work or whatever, you can expect to have some residual swelling on that side for 4 to 6 months. Because the reality is you also strain your lymphatic system as well as the ligaments and the tendons when you sprain it. And that takes a while. It's the farthest point from your body, from your heart. If we measured out, the distance, when someone has a heart problem, like congestive heart failure, and they have swelling on their right side but nothing on their left, that's one of the symptoms of a heart issue, as they have some swelling on the right side. So it's pretty far away from the heart, as you can see the distance. And so it can take longer for that fluid to also get pumped out too. But as long as this pain seems to start dying down, all right. But, I call it the happy window. He should start seeing some improvement within a 4 to 6 week window. That 4 to 6 week window is where you should really start to see the body improve, because that first week or so, you're in that inflammatory process phase. The body's taking out the old stuff, okay? They call that phagocytosis. Yeah, that's a word for you there, Lionel. You thought plantar fasciitis was bad. How about phagocytosis? That's where they go, the cells go in, they take all that bad stuff out, they put it through the bloodstream, and then they bring the healthy stuff back in. That takes a few weeks, and that's when you're not beating on that thing constantly, all right? Any excessive fluid in the body in long term is not good. Short term, it is. The fluid is meant to take absorption. It also helps to shut down the muscles so they don't work as hard, so you will have a less likelihood to actually put force through whatever joint that's injured, and that will also help. So long-term swelling slows down muscle fiber electricity connectivity, and so the muscles can't fire as hard as if you have a lot of fluid there. And so fluid long-term is not healthy for you, as well as that's an extra medium that everything has to go through. And so that's not good. It can make things feel weak. You have these little things, these little nerve fibers in here that we call in the business proprioception. That's the awareness of your joint is in space, and fluid also affects that short term. And so your muscles being able to react naturally without you thinking about it on an uneven surface like grass or cobblestone or whatever. Or if you can, or you're not paying attention, you go down that step real quick and you're fine. That's your proprioception system kicking in and stabilizing your muscles so that you don't hurt yourself and you come down rigid. And so fluid and stuff like that affects that system, and it can make it also easier to get injured. Hi, Nikki. Thanks for coming. I'm going to have to give Nikki number 3 because Nikki, I've known Nikki almost since I've been on YouTube. All right, Nikki's my 3rd moderator. So she's been here with me for cheapers. Almost since the time that I started getting some decent subscribers. I put a bunch of content out there, worked really hard, and then I started, let me see if I can actually get some people that actually want to either listen to, or hopefully maybe family members, or maybe just trivia questions. Maybe some of this information will help you in a board game or whatever. But anyways, there's a lot of useless knowledge up in this head, and I figure I'd get it out to the people. Oh, thank you, Nikki. You're sweet. All right, so we talked about swelling. Dave, does that kind of answer your question, hopefully? $50 words. Well, it was about $120,000 worth of college debt, so yeah, $50 is probably right. All right, so we went over all that stuff. We went over basic sprained ankles. Now, you can sprain any part of your foot, but those are the classic where you turn your foot in and you have that swelling there. So hopefully, Dave, if you have any more questions about the ankle sprain and your son, Dave, just kind of give me a shout out and I'll try and clarify any more than I already have. But if I can get this back on here, I've only had this on a few times, so it's one of my newer models and it hasn't been in and out of that shaft very much. All right, so we went over plantar fasciitis, Achilles tendonitis, sprains, heel spurs, tarsal tunnel, High Wisdom Gold TV. Yeah, right. Oh, hi. How you doing, Wisdom Gold? Thanks for coming. Hopefully some of my moderators, if you haven't connected with them, they're very good, even the ones that aren't moderators. These people, I've seen their stuff for quite a while. And they come to my stuff, I go to their stuff. So I know these aren't people that are just going to click on for 5 seconds and ruin your entire video. And so I always say, do unto others if you would have done unto you. And, what goes around comes around, and that's true. That's absolutely true. So that's why I try and see as much content as I possibly can. I don't even watch TV much anymore because I'm watching everybody's content. All right, so let's go ahead. We're going to go over bunions next. And so this can be part genetic, this bunion problem. And so what the heck is a bunion? So if we looked at your big toe, what happens? Oops, if I don't break this thing, my brand new model, I'll be mad at myself. But anyways, that big toe starts to turn inwards and it starts to thicken this joint. Now, every joint in our body has what they call a capsule or ligament around it. Our joints are nourished by synovial fluid, kind of like our spinal cord and our spinal nerves and our cartilage in our knees and so on and so forth. It's synovial fluid that nourishes those joints, lubricates those joints. The old saying in PT is motion is lotion. What that means is essentially is static loaded positions is not healthy for any joint, because it pushes that synovial fluid out and it can't come in and out like it's supposed to. That synovial fluid brings the good stuff in and takes the bad stuff out, kind of like what the blood cells do for muscles, tendons, and everything else. And so what happens is over time is that capsule starts to get thicker because it's taking a lot of stress, and it can start to ossify and harden. All right, kind of like what happens to our disc as we age. People don't realize, but our disc over time starts to ossify and it gets dense and hard. It's less likely to get a herniation in a disc, but it's also easier to get what we call spinal stenosis in that case, as our disc starts to harden. I haven't thought about that. I do have a few of those Average Joe PT t-shirts. You know, I started Scully probably, I don't know, you can look back. It's probably 8 or 10 videos ago. And I thought, you know, instead of me just kind of talking, let me go ahead and get somebody else in this case, Scully, and see exactly how well he does. I get a lot of positive feedback from that. And so I'm going to continue not only obviously bringing Scully in on my videos, but I'm also going to bring him or her, whatever you like to, whatever you want to call them, or a non-gender, whatever. I'm going to start bringing more video time in on Scully and see how I do with that. And then at that point, I might actually start talking to my beautiful girl that did my t-shirts. Let me look here a second. Now I know I have her card here somewhere. I don't know her. I don't remember her last name, but I know her first name. Her first name is Kamisha, and I can't. Oh, where is that card? Now I know I had that card here. I'm sorry, Kamisha. I know that card's here somewhere. I just can't remember where. I know I didn't throw it out. Probably my, you know, I got 2 kids and a wife, and God only knows what they do, but I'll find it. But anyways, yes, sucks to get old. I love Scully. Thanks, Dave. I love Scully too. But her name is Kamisha. She's really nice, and she did those other t-shirts. And I gave her a shout out on one of my videos a while back when I first started doing that. I just thought I want a branding, and so that's kind of like my brand is me kind of in a certain position with all these different people doing exercises in my kind of like my forefront background area. So that's kind of like my brand that I start out with, and I'm going to kind of continue to do as time goes on. But anyways, enough of that. Let's go ahead and talk about the bunion. And so like I said, that tissue starts to get thick. And as that tissue gets thick and ossifies, you start to get this huge bulge on the outside of your foot. And so when you take a step, you're normally supposed to push through your toes when you take a step. But the reality is this: if that thing is thick and ossified, it won't happen like that. You'll start to walk on the outside of your foot, excuse me, the inside of your foot. And then that starts to get a thick callus on it, and you have problems there. So what they do, if it's giving you pain, they'll go ahead and shave that down. They'll sometimes then cause a fracture to occur and break it and bring it back forwards, and they will literally put a pin through like they did with this nice little skull foot here, skeleton foot, and keep it that in a line. And then obviously for so many weeks, and then once it heals up, they take the pin out. And so then you're left with at least a toe that's straight. Sometimes they do it for cosmetic, or what we call cosmesis in the business, but sometimes they do it just because it hurts and it's messing around with their walking pattern. It can also give them plantar fasciitis because that fascia comes all the way up through your foot, and if that fascia is turned this way, being stretched constantly, that can give them a lot of pain. And so that plantar fasciitis can definitely be a cause with the bunion problem. Wisdom goal. I have a doctorate degree in physical therapy, so I guess, yes, technically you could call me Dr. Kenny. That's what's on my diploma from Mercy College where I went. I don't call myself doctor. There's a lot of physical therapists out there that do. I think it confuses the public. Well, I know my profession is trying to move towards that. I just feel that it confuses a lot of people. I can't prescribe a medication. I can prescribe an exercise program. I can do certain modalities like e-stim and ultrasound. There's dry needling we can do. I don't specialize in that, but you could do that. There's all kinds of other what we call modalities that we can do in the business. But I just, for me, I just call myself, obviously, as you can see my title, Average Joe PT. But yes, I just thought it confuses a lot of people. Call myself Dr. Kenny or Dr. Joe or whatever. How long have I been doing lives? I think this is my 4th live. This is my 4th one. My 3rd one didn't go so well. The software program I was using, which was, oh shoot, now I'm forgetting, OBS. I tried everything. I have really fast internet. I have a very fast computer. I have a brand new camera, and it kept freezing up the frame of the picture. It would work. I get a few people and it would freeze it up. My sound would continue, but it would freeze. I changed all the settings to make the video the forefront of the speed, and it still would freeze out on me. So I just went to my good friend Melda, the Melda family, M-E-L-D-A. I'm probably not pronouncing it correctly. I think he's Australian or French or something. He told me about this new program, and obviously, as you can see, it's working just fine for me. Oh, thanks, Harry. You're awesome. I really hope. I mean, really, this is free information. I mean, I'm not doing hands-on. The hands-on, obviously, that's your licensed provider. You're providing service and stuff like that. You get paid a lot more. But this is just basic information out there. Excuse me, that you can find all over the internet. I'm just here, kind of giving people some tidbits that hey, if you have these problems or you see these issues going on, I'm hoping some of the information I give to you guys can hopefully help you. This does not absolutely tell you not to go to the doctor if you have a problem, because I don't know your medical history. I don't know what's going on. I didn't evaluate you. All right. So all that type of stuff, liability wise, if you're still having other problems, this is not a prescription to solve your issue. I have a solid connect. I use TP-Link for my house, and that has extra Wi-Fi, as well as my computer is connected a solid cord into that. And so I think mine runs like 300 megabytes a second or something like that. I got high stream fasting modem speed through, I don't know what the heck, they keep changing their name, but so it definitely is not my speed at all. And my computer is one of those fancy built computers, so I can run 10 videos at the same time without my computer freezing up. So it's not that, as well as my kids currently watching TV on the internet, playing on their phone, playing on their tablet. My wife's probably on her phone. So all that stuff's going on, and we're still running fast here right now. And I'm running at 720p, the highest that they'll let me do. Yeah, I'm not having any buffering, so I don't know what's going on. And I went on a couple of different internet sites to figure out, like, was I doing something wrong with that OBS? And I don't know. I just follow my good Melda, the family that I just went off of his live a while ago, and he just, I just started doing this steam. I guess there's another one out there, but I'm doing this one for now. If I get a lot of people in here and I start getting longer, I'll probably go to the purchased one. I think I can do 20 hours at this point on the free one, and we'll go from there. We'll see what happens. All right, so we went over a lot tonight, folks, and let's go over a few more things since you're all here and you're willing to stay. I got 5 or 6 beautiful people in here, probably more like 5 because one of them is actually me. Another thing you can have that you see every once in a while is the outside, your fifth toe on the outside of your foot. You can get these weird fractures on the outside of your foot that happens every once in a while. Or a sprain, just because the way the design of the foot is, that bone that kind of jets out a little bit, that fifth toe, and kind of comes through. Unlike on the inside, it's kind of one small, flat, smooth surface. When you roll your ankle sometimes, that bone sticks out and you could cause a hairline fracture and have a lot of radiating pain along the lateral or outside of the foot. You can get black, obviously, if you get a fracture, it's going to be black and blue and purple, depending on how bad it is, as well as the sprained ligament. There's 4 types of sprains. And so you see a doctor and the doctor says, yeah, you sprained your ankle. There's 4 phases or phrases, I could say phases. Yeah, 4 phases to a sprain. This sprain phase 1 is what everybody thinks is going on. Oh, I just twisted a little bit and I'm fine. Type 2 is it's a pretty good inversion sprain or whatever sprain. You strain that ligament pretty good. 3 is you tore it pretty solid, stretched it out. That's one you're probably going to have to be in probably a cam boot or whatever. It's going to be black and blue and purple. 4 is you tore the thing right. The ligament is avulsed, what they call, or a 4. And so there, you might get away with it depending on how bad it is if it heals up. Sometimes the doctor might put you in a cast or just what we call a cam boot. It's a giant boot that goes up the side of your, goes into your, up to about the mid part of your, bottom part of your knee. And that basically is there to kind of support the entire ankle as one joint so that it can heal itself so you're not moving your ankle around. Yeah, Wisdom Gold. Go ahead. Shout it out. What type of question do you have? Or wisdom, I should say. What you got, Wisdom? I always say this. No question is a dumb question. Only one that was never asked. So, okay. Until I see it come through the system, I'm going to go ahead and just keep going. All right. And so the bunion is there. We talked about where you can get a fracture on the outside, that 5th metatarsal head. We went over, like, if you have a fusion or surgery within the ankle and what we have to worry about. We got to make sure that that shin bone or tibia can still come over your foot. That means that Achilles tendon has to stretch out a lot more and give a lot more, because that has to compensate so that the tibia can come over, what we call tibial translation in the business. That tibia has to translate or shift over that foot, and if it doesn't, you're going to have a lot of problems. You're going to move with your whole body, and you're going to limp and have all kinds of what we call gait deviations. So there's that. There's the plantar fascia, the heel spurs. Lionel asked some questions. We went over some basic treatments. I do have a video specifically on that under ankle and foot if you want to look on that, if you have plantar fascia issues. We went over tarsal tunnel. I have a video. I think the picture actually shows one of my ankle and foot where I show the tube, the therotubing rubber band coming down and around. It's blue. That's kind of showing you what the tarsal tunnel and the direction of that is. And I went over some treatment techniques of that and taping techniques for that, that they can help reduce some of those issues. Oh, okay. No, it's average. Can I ask a question? Hi, Wisdom. Creative, hereby, hi, we are family. Oh, okay. Sorry, Nikki. I thought you had a question. That's my bad. Okay. And so we went over heel spurs and spurs or what they are, whether they're an osteophyte or calcium deposit or whatever, depending on where we're talking about in the body. And that's basically the body reacting to trauma over time, and it builds up that thickness, and then obviously that causes other problems. We went over the hook, what we call a hook of acromion in your shoulder, and there's different phases to that. There's 3 phases to a hook on the acromion. We went over the ankle sprains. What else did we go over? We went over bunions. We went over tendinitis and how you can kind of treat that, the different 3 phases of a tendon problem, the peritendinitis, tendinitis and tendinosis. Tendinosis being what most people have. Oh, one thing I didn't say is that something that's chronic is anything that's been going on for 3 months or longer. So there's acute, subacute, and chronic. Those are kind of the 3 phases. And so most people think that it's an acute, and realizing that it's been going on for 2 or 3 months, it's technically chronic at that point, because the body should have healed itself at that point. And if it hasn't, that's a kind of a yellow flag that, you know, hopefully if you went and saw either a physician assistant, nurse practitioner, or your primary care doctor, to have them look at you and make sure that it's nothing else going on. Because the body, if you don't know, is you know, people might think it's mysterious, but there's a lot of things that might look simple. In reality, something else is seriously going on, and a lot of times you need to give that doctor all that different symptoms that you're having in your history to make sure that you get the right diagnosis. Because it's very easy, if it looks like a duck and quacks like a duck, sometimes most of the time it's a duck if you get enough medical history and you know the person's history. Sometimes it's not. I've had a few cases where, you know, person thought they had back problems, sciatica. They went and saw a chiropractor for a while. I've told this story before. They were getting treated by a chiropractor for a while. They weren't getting any better. They went to their MD. Their MD kind of said, all right, let's do an x-ray. The x-ray came back wonky. They went and had an MRI. The MRI showed plaques on their spine. They actually had MS. They had multiple sclerosis. All right, so some things that might look like a sciatica back problem, in reality, could be something vastly different. Could be a kidney problem. Could be something else. So always be mindful that something that's been going on for a while, you want to look into it. Don't ignore symptoms. Thank you, Lionel, for coming by. I appreciate you. Oh, Harry had to go. Sorry. I didn't see you, Harry. My bad. How long have I been on, guys? I have no idea. Oh, I've been on for an hour. I've been on for an hour. So, all right. I'm going to leave it at this point. If you guys don't have any more questions about the ankle or foot, I'm going to leave it at that. I think there's only like 2 of us left in here. So if David's good and Sweet Nikki's good, I'm going to call it a night. And this Saturday, of course, now I should have probably did this in the beginning. You'll see it anyways. I'm going to be doing taping of the shoulder, as well as I'm going to be going over the progression. If you strain your shoulder, if you hurt your shoulder, what you're supposed to do to progress actual strengthening exercises. My last week's video that I showed on Saturday was all about treating shoulder pain, just trying reducing the pain. This week, I'm going to go over some more about the mechanics of the shoulder real quick, because I know those videos are more like action-packed. That's what I want to make them more exciting with me and Scully. And I'm going to go over some basic exercises that you can do at home if you've hurt your shoulder, or if you know someone that's hurt their shoulder, and how to kind of rehab it by yourself at home without making your symptoms worse. All right. Thank you, you two. I'm going to call it a night. Much love. I'll see you guys later. Bye for now. Oh, I almost forgot my slogan. Look up and keep smiling.